Consider this for a second. What if a medical miracle costs just mere cents? It's a pretty striking contrast, isn't it? We are so conditioned to just automatically associate efficacy with expense in healthcare. But today, we are going to unpack the science and the landmark historical evidence behind a humble, everyday pill that you almost certainly have sitting in your bathroom cabinet right now. We're going to see exactly how this tiny, super cheap tablet fundamentally altered the trajectory of cardiac care forever.
The deadly ripple effect. Okay, so before we can really appreciate the cure, we have to understand the crisis. What is actually happening physically inside the body during an acute coronary syndrome or ACS event? It's not just one single isolated failure. It's more like a deadly ripple effect, and it all starts so incredibly small. Step 1. A tiny, microscopic tear occurs in an atherosclerotic plaque inside a coronary artery. Step 2. This injury sends out a chemical alarm, which triggers platelet aggregation. Basically, your body thinks it's bleeding, so platelets rush in to patch the tear. Step 3. These platelets clump together and form a thrombus, which is just a fancy word for a blood clot. And finally, Step 4. The clot grows rapidly, completely blocking the artery, and the heart muscle, desperate for oxygen, literally begins to starve. This entire cascade happens remarkably fast. So to save the patient, you have to break this chain reaction immediately.
Well, this is where our humble hero, Aspirin, steps in to perform what emergency medicine experts call a quiet correction. You see, it doesn't just mask the chest pain. It literally halts that deadly ripple effect in its tracks. It does this by irreversibly inhibiting an enzyme called cyclooxygenase. And by doing that, it prevents the formation of thromboxane A2. Without thromboxane A2, the platelets simply cannot stick together. The clot stops growing. It's brilliant. So administering aspirin early isn't just checking a box on some hospital protocol sheet. It fundamentally changes the patient's biological trajectory right down at the cellular level.
Part 2. Clot-buster versus aspirin. All right, so we know aspirin is clever, but just how strong is it really? Well, to find out, the medical community set up the ultimate clinical test. It was a true David versus Goliath showdown in the world of cardiology. In one corner, weighing in as Goliaths, we have streptokinase. This is a potent, highly sophisticated, intravenously administered drug, a literal clot-buster designed to completely dissolve the blockage. And in the other corner, David, good old aspirin, a humble, cents-per-pill inhibitor that just stops platelets from getting too sticky. Honestly, how could a cheap tablet possibly compete with a sophisticated intravenous clot-busting drug?
Part 3. The landmark ISIS-2 trial. To answer that question, we have to turn to one of the most absolutely crucial pieces of clinical research in medical history, the Second International Study of Infarct Survival, widely known as the ISIS-2 trial. This is where the sheer power of these treatments was put under a massive microscope. And I do mean massive. Look at this number. 17,187 patients. These were individuals arriving at 417 different hospitals with a suspected heart attack. When you have a sample size this massive, the data you get isn't just a suggestion, you know? It becomes undeniable, concrete scientific fact. The credibility built into a trial of this scale is just immense.
Let's break down how they actually ran this huge operation, because the trial parameters were brilliantly designed. They included patients up to 24 hours after the onset of their pain. It was strictly placebo-controlled, and patients were sorted into 4 distinct randomized paths. Group 1 got the heavy hitter, streptokinase alone. Group 2 got just the aspirin, 160 milligrams a day for a month. Group 3 received both treatments combined. And Group 4, our control group, received neither. The stage was officially set. The entire medical community was waiting with bated breath to see if the expensive clot-buster would just entirely eclipse the cheap little pill.
Part 4. A synergistic medical miracle. And what they found when they looked at the 5-week vascular mortality data? It completely shook the foundations of emergency medicine. I mean, it was a totally jaw-dropping moment. Get this. Aspirin alone produced a highly significant 23% reduction in vascular mortality. The sophisticated clot-buster, streptokinase alone, produced a 25% reduction. The underdog practically tied Goliath. No way, right? But it gets better. When patients received both the clot-buster and the platelet-stopping aspirin together, their effects didn't just overlap, they were additive. Teaming them up yielded an astonishing 42% reduction in mortality odds. That is just a massive, massive leap in survivability.
Now you might be thinking, okay, but this probably only works if you rush the patient through the hospital doors instantly, right? Well, actually, scratch that.
The ISIS-2 trial proved that this powerful synergistic benefit was observed across all timeframes. Whether the patient was treated 0 to 4 hours, 5 to 12 hours, or even 13 to 24 hours after the pain started, the reduction in mortality remained highly significant. Obviously, every single minute counts, but this proved that the intervention was a powerful lifeline even for late arrivals.
Of course, no medical explainer is complete without objectively checking the safety and side effects, right? So streptokinase alone did have some drawbacks. It was associated with a slight excess of bleeds requiring transfusion. Furthermore, when used all by itself, streptokinase actually had a reported excess of non-fatal reinfarctions, which basically means patients having another heart attack later on. But here is the brilliant twist. Aspirin significantly reduced non-fatal reinfarctions and strokes. So when they paired aspirin with streptokinase, the aspirin entirely avoided that excess reinfarction problem caused by the clot-buster. The super cheap pill was literally acting as the perfect safety net for the heavy-duty drug.
Let's distill all of this down to the final, undeniably significant bottom line. For patients who were allocated the combination of streptokinase and aspirin, the death rate was 8.0%. For those who received neither, it was 13.2%. Now, 5.2% might not sound huge at first glance, but to put that into perspective, in the vast scale of global populations, that 5.2% absolute difference translates to countless human lives saved. And this was all verified by follow-ups long after the trial ended. The life-saving power of this medical team-up was just absolute.
Part 5. Your Everyday Lifeline. So, we've looked at the history and the immense clinical data from the trial. But let's bring this right back to your reality, to the modern, everyday medical protocols that paramedics use if they ever have to pull up to your house today. Because of the ISIS-2 trial, aspirin is now universally recognized as a foundational pillar of emergency care. For instance, the Australian Resuscitation Council gives aspirin a Grade A recommendation. For suspected acute coronary syndrome, the standard is a 300 milligram dose. And crucially, they tell you it's meant to be chewed or dissolved. Why? Because you want the fastest possible absorption into the bloodstream to step in as early as possible and stop that deadly ripple effect we talked about earlier.
Impact isn't always about the gory stuff or the most expensive technology. The puzzle of survival isn't just built all at once with a magic wand. It's built in pieces. It's about those small pieces we place quietly, deliberately, and consistently, armed with the knowledge that a humble, inexpensive pill is a true lifeline.
Which leaves us with a pretty fascinating thought to wrap things up today. If a tablet that costs mere cents can literally rival sophisticated synthetic drugs and slash mortality rates by nearly half when used in tandem, what other lifelines are hiding in plain sight in your medicine cabinet right now? Keep asking questions, keep looking closely at the simple things, and thank you so much for joining me for this explainer.